joining me this afternoon, and I'm happy to spend some time with all of you to discuss Monroe County's response to COVID-19 in our community. The goal that I wanted to accomplish today was to have more of a regular dialogue with all of you, to be able to update you on a more regular basis on our efforts here, and then be able to answer your questions or take your questions. If I don't have the answers, obviously be able to look into some information for you. But my goal here really is to keep the public informed and to let you know all the efforts that we have going forward. Today, there's a couple things, though, that I really wanted to put on our radar and have a conversation about. First and foremost is our social distancing efforts as a county and as a region. As you know, we operate as our hospital systems operate as a region. And while we report our Monroe County numbers every day in the effort of transparency and helping the public to understand where we are as a community in dealing with COVID-19, our hospital systems serve a 13-county region. And so it's important for all of us to be working together in Monroe County and outside of the region to on strong social distancing techniques. And we started very strong a couple weeks ago. There's some websites that we've talked about that have that rate you and give you grades, and we started very strong. But we've slipped down from an A, I believe, to a C rating. And so there's a lot we need to do to double down on where we are. And the reason why is because, as you've seen our numbers over the last week or so, we've been looking at where the curve is and where we are and where we think we're going. And as a community, it looks like our numbers, we are not on an exponential curve at this point, but it looks like we're more on a linear or polynomial curve, which means we're still increasing. Our number of cases continue to grow every day, and the impact here continues to grow, but it's not on an exponential rate, which means that the social distancing efforts that we took 2 or 3 weeks ago in terms of closing schools, closing non-essential businesses, and really encouraging that 6 feet separation between us has had an impact. And the impact was to prevent that exponential growth. So now is not the time to let our foot off the gas pedal, despite the fact that it does look like we're not on that exponential growth right now. But what we really need to do is double down and make sure that we continue those efforts to continue to make sure we stay on that trajectory. It's a little too early to know whether or not how long we'll continue on that and whether or not we will. But it's going to be up to all of us to work together to make sure that we continue in the direction that we've been in, and I think we can continue to do even better. So I've received a lot of questions about enforcement and what we will be doing to enforce social distancing. First and foremost, I want to just ask for everyone's cooperation. This is going to go well, and we're going to continue to excel at our social distancing efforts if we all work together. And that's going to take supporting each other, because we know this is difficult and this is hard for a lot of families. And there's some fatigue that's obviously going to set in. So we really need to work together to do this. But we are undertaking a few enforcement actions for you to be aware of. First, we have worked with a collaboration with our towns in the city of Rochester with their code enforcement units to make sure that the governor's New York State on pause order is enforced, and that comes with fines of up to $1,000. And so we've been working with our code enforcers, and we will enforce that code here in Monroe County to ensure that businesses that should not be operating are not operating, and that we are maintaining that proper social distance protocols that have been set forth by the state and the county. We've also begun a collaboration with law enforcement to make sure that we have a good education campaign, and then back that up with an enforcement as well. So first of all, the information campaign. We have worked with our partners in Napier, Causewave, and many, many other partners around this community to put together a public service announcement campaign to really get this information out. You've probably been seeing a lot of that through our TV ads. There's been social media, there's been billboards. This week, there will be advertisement campaigns going up on the buses, on buses, RTS buses, as well as lawn signs going up and things of that nature. We've partnered with FoodLink to put information about about social distancing in the food distribution, and we've been doing a lot in terms of that effort with education. There's also signs going up at many of the county parks to remind folks to keep 6-foot distance. And as soon as the weather gets just a little bit nicer, we also have a stenciling program that is going to go out and actually delineate where are the 6 feet markers between people, so that we can demonstrate how far folks really should be staying away from each other and keeping that proper distance, because right now the county parks are open. And I would like to keep it that way. I would love to see our parks continue to be open. So as the weather does improve and gets nicer, we can go out, get fresh air, and avoid cabin fever in our homes. But to do that, we have to be responsible. So we're going to be monitoring our parks, and our park staff is patrolling to make sure that we're doing that. We have seen some issues over the weekend of places in different parks. And so we're going to be keeping a very close eye on that. And if the social distancing efforts don't work, we will have to take that next step. But I'm really hoping that the community here can come together and we can keep the parks open as long as possible so you can enjoy that use. We've also partnered with law enforcement. Today, law enforcement will be receiving cards from us with information on COVID-19 and social distancing, so that if called to an area, they can engage the public and have that conversation about what is safe behavior and what is not. We've also worked with the 911 center to create a code so that residents who call 911 when they see a large gathering or something happening in violation of our social distancing protocols, they can engage with law enforcement, and we can start to track where hotspots are occurring around the county and be able to be more proactive in working in those areas to prevent those large gatherings from happening in the first place. So we have a three-tiered approach here and a strategy to try to enforce social distancing, but the best enforcement really is for all of us to work together as a community, share information, and provide each other safe ways to engage and work together and be together, whether it be through Zoom sessions like we are right now, having this press conference, or through WebEx or things like that nature, and be able to do things remotely and have those conversations. That would be very important. The other thing that I wanted to discuss today was around school closures. This was obviously in the news over the weekend related to New York City and the state of New York, and so I'd love to be able to address that. Here, as we talked about, opening schools is always going to depend on where we are in the curve and how much longer we think we have until we come out of the on the other side. And the last thing we would want to do is reopen schools and then too early, and then have those schools become vectors for the spread of disease. So right now, the school closures are being reevaluated every 2 weeks on that basis. And a lot of folks I know are at home right now wondering, when will we go back to school? When will my kids go back? While it's possible that schools will open again before the end of the school year, I do think it's unlikely. And we need to be preparing ourselves for the fact that that we need to be engaged in distance learning and remote learning at home. It's something that the schools and the teachers have been working extraordinarily hard at redefining the way they do their jobs to be able to teach and still educate students, even though those students are at home. And I know they're working hard. Just this past weekend, my daughter's third grade teacher made a surprise visit to our home and dropped off books and some treats and some Easter candy. It was a nice surprise visit to have, and I know teachers are doing that all over the county. And they're also learning to do that. They're also doing this in a way they've never learned to do. This is new to everyone. It's new to the teachers, and it's new to parents. It's new to students. So again, we need patience. We need to work together. We need to understand that this is new. We've never done this before, but we can do it. And I fully believe that we can transition to distance learning and online learning, but we have to work together and support each other. And so that's what we need to do. Now, reopening them, whose decision it is to reopen? It's very similar to how they were closed. When it became clear that we had community spread and wanted to get out ahead of this, we worked very closely in collaboration with the school superintendents and our county health department to make that decision that schools could be a vector for spread. And then we also worked with the state of New York to ensure that the 180-day requirement for schools to be open would be waived so that our schools could be closed. The governor, via an executive order, did issue that waiver on the 180 days, and schools were able to be closed under my declaration of a state of emergency. Reopening schools will be done in a very similar fashion. It will be a collaboration with the school superintendents and myself and the Commissioner of Public Health. And it will also be done in collaboration with the state of New York to ensure that the 180 days requirement continues to be waived, or so that when the schools are opened again, there's no financial liability to doing that. So this is a partnership that we have here. It was a partnership when the schools were closed. And again, it'll be a partnership and collaboration that I would expect and suspect that we would have county-wide when that decision is made. So my expectation would be not a district by district decision. This would be a community decision, because this is obviously, we're faced with a condition that doesn't discriminate based on geographic boundaries or anything like that. It's going to affect the entire community. So I wanted to be able to update you on those two things, and I'm happy to take any questions that you may have.
Okay, well, we are going to start with Patty Singer from Minority Reporter, and Jennifer Lukey from WHEC will be next.
Hi, Patty.
Hi, Adam. Boy, it's just 2 conferences in a row I've had to lead off here. It's not even
there you go. It's your lucky day.
I'm more of a number 9 hitter here. So my first question is, it's about you. I mean, there's a lot of responsibility on you to keep the community safe. Mm-hmm. What are you doing for your mental health here while you're keeping the community safe?
Well, Patty, thank you for asking. Nobody's actually asked me that before. Well, I am blessed to have an incredible team that I work with here. I have 4,500 coworkers who are working around the clock and are professionals, and I trust them. And so I have faith and confidence in them, and we work together to do that. As far as my own personal life, my family is always number one to me. I go home to my 2 kids. They're 9 and 10 years old. My daughter just had her 9th birthday last week. And my wife is an educator from Gates Chili. And so we are as addicted to Netflix and binge watching as anyone else, and doing a lot of cooking and new recipes at home. But everyone needs to relax. And, the other thing that we do quite frequently is go for walks and check in on our neighbors. But I encourage folks, people say, you go outside, you see large gatherings, you see people getting together, and is that a good thing or a bad thing? It's bad that people are gathering and getting too close, but it's good to see people outside. You just have to keep that distance, because it's good to go for a walk. It's good for your mental health, and it staves off that cabin fever that I think too many of us have.
So there was an issue, over the weekend, in the city with that large gathering for the vigil. There are a lot of people who are struggling with mental health, living alone, and don't have the resources. What do you see that is happening to the collective mental health as we go through this, and how is that affecting the inability to social distance? What's more important, our mental health, our social distancing?
Right. That is a very important balance that we have. And there are mental health programs, and there's some support and resources that we have available through our website, monroecounty.gov, and also our hotline, 753-5555, that individuals can access. But this is clearly not an easy time for folks. I am aware of what happened over the weekend, but I've been aware of, made aware of other instances around the weekend as well, where people were gathering. I think that we need to, and this is why I said support each other as a community. Obviously, when a family loses a loved one, there's a grieving process. There's a community process where we do need to come together. We just need to work with each other to find ways to do so where we can maintain that 6-foot distance, or stay within our family nucleus, but still be able to have that support from our friends and our family. This is not easy to do. We've never done this before. So I don't think overly charged rhetoric or language is appropriate in addressing that. But instead what we need to do is come together to find ways to have that grieving and find that support and help each other to do that. And I think that we can do that through remote things like this. We can also do that by having gatherings, but keep that distance apart so we can still be with each other. But we need to do it in a socially distant, responsible way, because being by keeping that distance and stopping and slowing the spread of the disease is going to save more lives in our community. And the goal here is to get out of this to the other side, saving as many lives as we can.
Thanks, Patty. Next is Jennifer Lukey from WHEC, followed by Brett Dahlberg from WXXI.
Hello, Jennifer.
Hi, how are you, Mr. County Executive? Thank you for taking our questions today. I'm going to start with a question. You mentioned that you've been talking with towns and village code enforcement. To your knowledge, have any of them actually cited businesses who are open and continuing to work after being non-essential, deemed non-essential?
To my knowledge, that has not happened yet. I haven't checked it with them yet this morning, but to my knowledge, that has not been necessary yet.
Have they had to give warnings?
I know there's been numerous warnings out there, and there's been complaints that have been made. And so we will, I should have that data because we've been coding them. So we'll have that data in the next couple of days to be able to say how many have been called in. But that coding process is still new. So we're still just tracking that data now.
Okay. And over the weekend, the governor signed or said he was going to sign an executive order mandating all businesses that are essential provide masks to their employees. Do you think that those companies should be making sure that those employees wear the masks?
I think that, and like I said a week ago, I think universal masking is the right thing to do. And I would strongly encourage everyone in this community to wear a mask when they're out in public. And that includes when engaging in an essential business. And I think that also includes our essential businesses being responsible in masking their employees. So I do think that everyone should, as a point of personal responsibility, because remember the purpose of wearing a mask. When you're wearing, unless you're a healthcare professional, you have a really well-fitted mask, wearing a mask that any of us can have at home or can obtain is really about preventing other people from getting sick. That's really what it is. So, I feel fine. I feel fine today. But am I a carrier of the virus, or do I currently have COVID-19? I may be asymptomatic. And so when I go to Wegmans, as I did over the weekend, I wore a mask because I don't want to infect anyone else around me. And I don't want to be a vector for the spread of that disease. So I think it's a socially responsible thing to do is for everyone to wear a mask. And so I applaud the governor's executive order that he's issuing, and I would strongly encourage that everyone follow the order, but that everyone who's out in the public and interacting with other people should wear a mask.
Thank you, Jennifer. Brett Dahlberg from WXXI, followed by Dan Schreck from 13 WAM.
Hi, Adam. Thanks.
You're welcome.
Am I understanding right that the fines are only for businesses, that individual people or groups of people are subject to education, but not actually an enforcement action?
Correct. So right now, businesses are subject to fines. Individuals right now are subject to education and disbursement orders from law enforcement. Mm-hmm.
Do you think that's enough?
Well, right now, that's why we're tracking it. So we have a code system in place now that we're working with local law enforcement on to be able to report that back. So far, I haven't seen that as a problem yet over the last few weeks, and I haven't seen that in other communities where people have been fined just out in the public, like at parks or out on the sidewalk. But that's why we want to start with enforcement. With education. I think whenever it comes to an issue like this, you should always start with education. You should be engaging with the community before there's a punitive measure. Again, we should be offering advice and counsel to folks on how they can do those activities and stay connected, but do it in a responsible way. So I do think it's more responsible to start with education, and then we can look at our enforcement options.
Thanks.
You're welcome.
Brett. Dan Schreck from 13 WAM is next, followed by Gino Finelli from City Newspaper.
Good morning to the both of you, and thank you for having us. County Executive, if I can ask you, right now there are a lot of reports of nursing homes withholding coronavirus information regarding the number of cases, employees that have come in contact with infected residents. Now, I understand this is a state issue, but at what point does the county step in and say, we have a right to know how many cases there are? I believe Governor Cuomo said that there will be death counts released on a county-by-county basis starting today. But what about current cases, active cases within nursing homes in our area? At what point does the county say, we need to know this, these are our residents?
Yeah, I think that When it comes to nursing homes, there are a number of factors that are at play. And first of all, and it can be a very sensitive issue because we're talking about people's homes. This is where people live. And the county has little oversight over the nursing homes, as you just said. They really are governed and regulated by the state of New York. And the approach that we have taken as a county in terms of releasing information, because we want to be as transparent as possible here, is that we've been collecting data through contact tracing and other measures and releasing that to the public when we feel that there is a public health reason of why the public needs to know. So if you look back to at the very beginning of our first cases here, we released information about a bus that someone was on. We released information about a school district where an employee was working. And we started doing that up to a point where you're up to over 700 confirmed cases now in our county, and you have to start thinking and changing your thought process as opposed to trying to identify where the virus has been to just assuming it really has been everywhere. And that's why we've changed the way we talk about this so that everywhere you go, you should assume the virus has been there and you should assume you have it in the way that you interact with people. That's why we wear a mask. And you should assume people you're coming into contact with have it, which is why you keep a 6-foot distance. Particularly around nursing homes, we have been working with them over the last couple of weeks. We have a regular phone call conversation now with them to help them with their PPE needs. That's the personal protective equipment. We offer advice and training and things of that nature. But obviously and clearly more is going to need to be done because the folks who live in these nursing homes are the most vulnerable populations, and we need to keep the spread of this disease away from them. But it's obviously very difficult because you have nursing home patients that come in and out of other healthcare systems, such as the hospitals, and then obviously you have staff who's in there working with these residents every day. And the worst thing that you could have is it spreads like wildfire through a facility. So I think when it comes to releasing data, we've been taking the state's lead on that because I'll get back to your original question, which is because you're dealing with the sensitivity around this is somebody's home. And then you also don't want to create a larger panic that doesn't exist if you only have a piece of the information and not all of it. So we've been taking their lead on that release. We'll continue to do that, but we're also working every day with our nursing homes to make sure that they have the advice, the support, the training, and the PPE that they need to prevent that spread. And I will say this as well. The nursing homes are working incredibly hard. The staffs are working incredibly hard. The leadership is working incredibly hard to deal with an issue that they've never had to deal with before. And again, these are their residents. It's like family to them. When someone gets sick or passes away, this is a family member to them as well. And so we need to work with our nursing homes to make sure they have what they need to protect their patients and their families. We also don't want to unduly alarm folks when there is an issue within the nursing home. The way that is handled and should be handled through their contact tracing is to identify families of other residents within those facilities. Just as we identify the greater public when there's a public risk, they do the same thing within their facilities as well.
Okay, and then we know that the unemployment department recently launched a new website to help curb that influx of incoming calls. And according to the governor's office yesterday, those numbers are declining. However, there are a lot of people in Monroe County that do not have internet access or a computer to go online to fill out that new form and are still calling and can't get through. Is there a plan in place in the county to help those that are financially struggling fill out those forms online?
So if anyone who has trouble accessing any of the programs, so it's unemployment benefits, SNAP benefits, child daycare support dollars, any of those types of benefits can call our hotline at 753-5555 or email our email address to covid19@monroecounty.gov, and we can help with that support. So we can support individuals through the process of accessing any of those benefits. Obviously, we're limited in what we can do. If the website is crashed and the phone isn't working because of the influx, we obviously still have our limitations, but we are happy to. But we have people here on staff who can work with individuals in our community to access those benefits. We also have the same process in place for small businesses. Monroe County created a small business loan program that offered $10,000 in loans for working capital to businesses. And as part of that, we've created a navigator program where we have navigators who will work with business owners to help them through the application process and navigate the various types of small business loans as well. So we have those types of navigators and help on both the services for individuals, and we also have that for small businesses as well. The best way to access all of that, though, is through our hotline.
Thank you.
You're welcome.
Okay, next up is Gino Finelli from City Newspaper, and then Steve Orr from the Democrat and Chronicle.
Hey, Adam, how you doing?
How are you?
I'm hanging in there. So I was wondering, for non-essential businesses that you do find operating, you said that there has been a number of complaints and there has been warnings. When do the punitive measures come into place? Is it after the first warning, or is there a second warning? What's the protocol there?
Well, it does depend on the situation. So what I would say is generally we do education first and then enforcement second. You know, that would be the steps that law enforcement would take. But generally we like to start with education before a fine.
Gotcha. And for the average person who notices the bar on the corner of the street is still open, or whatever other essential business is still operating, what can they actually do? How do they reach out to the county and file a complaint and, have someone address that?
Sure. What I would recommend is that you call 911. And we have been working with our partners at the 911 center to be able to create a way to address those types of complaints, and then also a way to code those in our system so that we can track problem areas or repeat offenders. So I would encourage you to call 911 to file those complaints.
Gotcha. Thank you.
You're welcome.
Okay, Steve Orr from the DNC, followed by Jonathan Hunter from Spectrum News.
Hi, Adam. Just a quick question about something. We had thought the county's plan was to release more demographic data on Sundays about the age of those who had died from COVID, and also the racial and ethnic breakdown that we got a little taste of the other day. I didn't see it yesterday. Is that still coming, or have you rethought doing that?
Yeah, I think it is still. I think we went back to. I think we said we're going to start to report those on Friday. So I think we're going to get that this Friday.
This Friday. Okay. All right. That's all I wanted to ask. Thanks.
You're welcome. My pleasure. Yep.
Thanks, Steve. Jonathan Hunter from Spectrum News, and then Kayla Green from WROC.
Hey, Adam. How's it going? How you doing?
Good. How are you?
Pretty good. Just simple question, similar to actually Dan's question. What are you guys doing just to ensure that everyone in the nursing homes are staying safe? And I remember you mentioned earlier that you guys in the county don't have certain jurisdictions or powers over the nursing homes. But what are you guys doing to ensure that that spread is not going throughout the nursing homes?
Sure. So we have developed a regular call with all of the nursing homes, with the nursing homes and long-term care facilities in the county. We've convened these calls on a regular basis to share information, share best practices, and to have feedback from the nursing homes about their access to PPE and training needs. And then we can coordinate that response to the state. So we have those regular conversations with them because this is important. I'll also add this about nursing homes. What we are also seeing, and this is why I said, they are working very hard with the resources that they had, what they have. But we're also seeing, I think, the result of years of underfunding nursing homes and financial, when you underfund a system for so long, you start to run into problems, and those problems are going to be staffing, equipment, things like that. And those are things that we're now addressing in the middle of a crisis. And it's very difficult. The county runs a nursing home at Monroe Community Hospital. We deal with those same issues of making sure we have enough staff who can be there, because once a staff member becomes sick and they can't come to work, that's a problem. And so we have to keep good staffing levels, but then also with your personal protective equipment. Everyone does not sit on a stockpile. There's no funding for that. And that was never viewed as a need for years and years in the lead up to this. And so I think this is going to change long term, when you talk about what a life-changing event this is and a structural changing event, how the healthcare system has responded to this through our hospital systems, our nursing homes, our long-term care facilities. A lot of this is going to change, even on the county when it comes to how much we have. I've said many times, we have a supply of a lot of equipment, but we don't have a stockpile. And I think that a lot of the healthcare institutions are seeing that same thing. So this is going to have dramatic changes, I think, in the way we go forward for years to come.
Do you have a follow-up, Jonathan?
I do not. Thank you.
All right, thank you, Jonathan.
Kayla Green from WROC is our last question today.
Hi, Kayla.
Hi, how are you?
It's nice to see you.
Nice to see you too. So my first question is about schools, and over the weekend, the governor saying that he has the final say with schools. So I'm just wondering if you could just clarify, as we go forward, are you yielding to the governor fully on this, or how will that process look when you think schools should reopen?
Sure. That's an ongoing conversation, and it's a collaboration. The reason why is because local school districts are charged with making decisions about whether they open or close schools. Here, we made that decision to close them as a collaboration, as a community. So I was on that phone call talking with the school superintendents and the heads of each of the BOCES 3 weeks ago to make that decision. The reason why, but it's also a collaboration because New York State has rules around how many school days schools have to comply with. So it was 180 days of instruction. And so the state obviously plays a role in making sure our schools have the funding they need and that the school districts are meeting those obligations with the state of New York. So we've had a very good collaborative relationship with them. When we went to close schools, we notified the governor's office that was going to happen here, and they agreed, and the 180 days was waived right around that same time. So we've had a good collaborative relationship, and that's how it would work reopening them as well.
Okay. And then my next question is also regarding the public gatherings and what you were kind of mentioning about the hotline and all that. So just to clarify, because I've gotten a couple questions just through different means, people have asked me if they see their neighbors like hanging out with a bunch of people, like cars pulling up, and they know that these people don't live there, what would be the best way to go about it? I know you mentioned 911 and a hotline. So what are the different ways to do this, and what should people do?
So what I would recommend when you see large gatherings like that, you see gatherings really anywhere around the county that are breaking those rules, you should call 911. Okay, so that's my clear advice and instruction is to call 911 because law enforcement can't proactively look at a place to send people to enforce social distancing. We can't do that unless we know where it's happening. And I do see anecdotal things on Facebook. I'm on Facebook and Twitter and things. So I see that, or I'll get text messages from friends or family. But unless it goes through those 911 channels, there's a lot of anecdotal after the fact evidence. And so what I'm interested in, you're always going to have one-offs, but what I'm interested in is finding out where are the areas that have repeated violations of that social distancing protocols so that we can send law enforcement to be able to educate and be able to break that up. Okay. So I'll just close by saying this, and I appreciate everybody working with us today, and I hope I got some good information out there to you. I'm just going to continue to emphasize this whole notion of social distancing and what we've been doing. And I know this is difficult for everyone. We just went through Easter weekend and Passover, and everyone's families had to make adjustments to be able to celebrate those holidays in a different way. And there's going to obviously be fatigue setting in, and people want to move around and be able to go back to life as normal and life as we knew it. And the best advice I can give this community is that in order to get through this, we have to continue to do those practices and find better ways to be able to connect. This past weekend, yesterday on Easter was my mom's birthday. So happy birthday, Mom, who I think is probably watching this right now. But I wish my mother a happy birthday and happy Easter. And what we did was we went to her house, and the kids, chalked up the driveway and wrote messages and colored pictures. And we did that from the length of the driveway. And they were able to speak to their grandma. I was able to speak to my mom, and we celebrated the holiday and celebrated her birthday. And we did it in a socially responsible way. I think that's what we should be doing across the community, and we should be sharing those stories. We should be showing people, by example, our neighbors in our community, how you can do this. Because the better we do at this, the lower we keep that curve, the better the hospital systems are going to be able to deal with the increasing hospitalization numbers, the better our outcomes can be. We're still losing far too many people. We've lost 50 lives in this community to COVID-19. And my heart breaks for those families, and we pray for those families every day, as I'm sure all of you do as well. And to prevent more people from dying and prevent more people from loss, we have to do that. We have to maintain our social distancing a little bit longer. And how we know to come out of this is something that we're working on next. And you see that conversation all the time, but it's going to require more testing, both in terms of the test for COVID-19, but it's also going to require the antibody testing to make sure that as we open things up in the future, we do so in a way where we don't get that second spike. That's the last thing we need to do. So the irony of us doing the social distancing so well is that it's going to take us just a little bit longer to come out of it. But the benefit of doing that is that our hospital systems have not been overwhelmed yet. We have all the preparations in the world to handle that overwhelming influx if that happens, but hopefully we don't need that. And we haven't had that influx yet. But the irony of doing such a great job is it's going to take just a little bit longer to come out of this on the other side. So I'm asking you to work with me. I'm asking you to work together as a community. And I have all the faith and confidence we are going to come out of this on the other side a strong community. And we're going to do it by working together. So thank you all very much. I appreciate this.
Thank you.